Based near Retford, Rampton Hospital is in a rural Nottinghamshire location with easy access to Lincolnshire and Sheffield. It is one of only 3 high secure hospitals in the country, providing a comprehensive range of highly specialised services to adult patients who experience a mental health problem, personality disorder or learning disability combined with a history of offending behaviour. The hospital is host to several national high secure services, including the National High Secure Service for Women, the Deaf Service and the National Learning Disability Service. Our aim is to engage patients in a comprehensive assessment process and to support them as they progress through an individualised care package. This is focused on both providing care and treatment relating to the individual's mental disorder and also addressing their offending behaviour. We offer great learning and development opportunities, including apprenticeships, trainee nursing associate and preceptorship programmes. There is also a wide range of staff benefits, including discounts, various support packages and professional development opportunities. But don't just take our word for it. Let's hear from the people that work here.
So day to day we look after 16 male patients who've come to the hospital from a variety of avenues, and day to day we look after their physical and their mental health. So I came here 3 years ago. Prior to that I'd had no prior work experience working in healthcare, and I fancied a change and a new challenge. So when I qualify I become a Band 4 nursing associate, which is just below a staff nurse, and then I will go back to working full-time here at Rampton. So I'd like to continue my training to staff nurse, so hopefully the next step in my sort of career development will be to go and do the next part of the training, which is 18 months to become a registered mental health nurse.
I'm actually an overseas qualified nurse. I have came to this country and started to work within this department like 7 years ago. Started as a nursing assistant actually, even though I'm a qualified nurse from overseas. However, since I started within this trust, I had immense support to develop my career to reach up to now. So I've been thinking in here, we know all the patients has some history, all the patients how they act, and we do have like really good long 4 weeks training to know how to manage, how to behave to the patients, or how to understand them.
I started on the preceptorship programme, which is like 6 to 18 months, I believe, which was really good because it means you get that time before you're sort of a nurse in charge of a ward, or you're taking on that little bit more responsibility. It just gives you time to learn how things work. Every day is slightly different, but generally, you're doing medication for patients, making sure that all their needs are met, because we're being somewhere like Rampton, there's a lot of things that they can't do for themselves. So it's really, really good to work in a team and be involved in them sort of MDT decisions about patients. And I really enjoy being a named nurse for patients, working with them sort of on their treatment pathway and sort of move them on from Rampton. That's really rewarding when you can see somebody either when they go back to medium secure.
Day-to-day role is helping the patients time manage their day, promoting hygiene, helping them get ready in the morning, breakfast, dinner, tea, getting them ready for education. We do all sorts like horticulture. It can be a very challenging environment, and within the role of a healthcare assistant you have to wear many hats. So I like the varied, no 2 days are really the same. Rampton is close to my home and it's one of the biggest employers where I live, and job security really as well, working for the NHS. There's a lot of people around where I live that have a lot of good things to say, so I thought I'd come and try it out and not look back yet.
Working at Rampton, you're invested in as a staff member. I've had more training here in the 4 years that I've been here than I've had in any other role that I've had, even though I've been qualified and had training. It's just far more available here. We've got a fantastic line manager, head of service is invested in his staff and is willing to put in the work if it's what you want to do. He's got a vision and he shares that vision very well.
I chose Rampton because there is a lot of different services within one hospital. So you have so many different opportunities that you can use. If you want, there's women's, there's LD, there's the death service, there's all sorts of different therapies going on, multiple different ways. I'm lucky enough that I'm actually seconded from the ward 1 day a week, so I actually do dialectical behavioural therapies, and that was agreed by my ward manager at the time. And this is 5 or 6 years I've been doing that now. So I'd say 80% of my role is on the ward and 20% is doing therapies. And that's one of my favourite parts of the job, if I'm honest, because you get opportunities here that you might not get in other areas if I was a staff nurse.